have been following cervical cancer and cervical cancer issues over the years. 5 years ago, I was asked to MC a program for people living with that kind of cancer and for them to share their stories. And trust me, by the middle of the whole interview, I started breaking down, and the cases are still going like that. According to Ghana Health Service, about over 2,797 women are diagnosed with cervical cancer every year here in Ghana, and in that number, about 1,699 of them die. And so it's very important. Here in Ghana, what we do is we wait till October, and then we make a little noise about breast cancer, cervical cancer, leukemia, and all of that. And then once October is gone, it's gone. But here on Max TV, we take your health issues seriously, as we show on the show every single day. And today, we're going to have a conversation with a pathologist from Kolebu Teaching Hospital. Her name is Dr. Venerander. Thank you so much for joining us. It's beautiful to have you here. And you are beautiful.
Oh, please.
And you are beautiful. Just say thank you. Look at yourself.
Thank you,
Yeah. All right. So, like I said, I have been in the cervical cancer and cancer thing, being a journalist for so long, and I know what a sad situation it is for anybody to be in that space. We're talking about cervical cancer today. What brings about this deadly cancer?
Okay, so I want to start by saying a very good morning to your cherished viewers. We are in the month of September, and September is Childhood Cancer Awareness Month, and then Birth Asphyxia Month. And childhood cancers.
Oh, okay.
So cancers occur at any
pediatric cancer?
Pediatric cancers. Okay. And the commonest is leukemia. Okay. But then again, like you mentioned already, we don't wait till October to talk about breast cancer. Yes. It doesn't happen only in October.
Yes.
Cervical cancer is not diagnosed only in January. Okay. So like every now and then we have to remind your viewers that yes, things like that exist. So the statistics you mentioned are very accurate. Every year we have about 3,000 women diagnosed with cervical cancer, and then out of this about 1,600 die. I have to mention that cervical cancer is one of the cancers that we know what causes it and we know how to prevent it. A lot of work has been done, such that if you're diagnosed with cervical cancer today, then it's your own fault. You haven't done well for yourself.
Hey, Mami Akabrofu no say Ghana ha. I mean, the Ministry of Health Ghana Service any a doctor for aye juma bebre say so we your bana wo Ghana ha na unya cervical cancer na cervical cancer say na ebi kana and walo wala. Why would you say that?
Because we know that okay, so like I mentioned already, we know what causes it. It's a virus. How do we get the virus? Through sexual activities. Now, it's not every sex.
Can you mention the virus, the human papilloma virus?
Human papilloma virus, okay. HPV. Okay. Now, the HPV, we have different types of them. There are two that are very notorious, and there are numbers attached to it. That's HPV 16 and 18. Those are the common ones that cause cervical cancer. Otherwise, we have other types as well that cause other things. Okay, so what do I mean by sex? If you had sex very early in life, as at 16 years, you started having sex.
Oh, some are having sex at 11, so.
Okay, so that's one of the risk factors to cervical cancer. So if you have sex very early on in life, if you have multiple sexual partners, what do I mean? A woman has more than 3-4 sexual partners of a lifetime. And then if you have one single partner, but that partner has multiple sexual partners, anytime he sleeps with you, it is assumed that all those other ladies have also slept with you.
What can bro for me tremu twi kakra ma me se wo hyase e di mpam agro ntemu a etumi de no ba na wonsusu e bia na wo de wonim se unipa wo ne wo ho onu nkwa na no wo ho but so onu nsusu e wo mpena hodo a each time onu obeda no e doctor fo adwene mu no woni emma na se mema onu omu nyina ada no nsusu ada enti yare enemu san yare bi e wo wo ho no nsusu betumi enya bi.
And then if you have unprotected sex, so condoms are available. Condoms are not for sale in various facilities. So we have family planning units where condoms are not for sale. So as much as possible, you can walk in there, get your stock of condoms, and then anytime you want to have sex, you use them. It's one of the good ways to sort of reduce your risk of cervical cancer. Now, apart from sex, these are the common things that cause cervical, that exposes you to the virus that would give you cervical cancer. Now, how do you know you have cancer? The bad thing is that you don't know. In the very early stages of the disease, you have no sign, you have no symptom, nothing happens to you. So we say that you should screen. In fact, today I am here to tell everybody that you should screen. It's very important and it's very helpful because cancer diagnosis in Ghana is very expensive and is debilitating.
Screening, not just say, na yemfa wahudie na no honam kakra bi emfie numune since I call that interview dey bi am come here me enye ya enye hu mia mi di hu adanse ye machine kakra bi betwe aba na yi wahudie na no honam kakra bi ni yakohwe me bo a
na kra nya honam se akra ye ko honam wo de brush bi bekom na wa brush eno ano
ye ko swap keke
and there are two types. We have the HPV testing which has come now. So when you do that test, it's able to tell you if you are positive or negative. And then with that, you follow up with a pap smear. So anytime you go, the machine, some machine I can, the share our audience, na you be, na you cervix no. And say, na you have brush no, you are shame, na you brush it. You have cells now, then you put it in a liquid based, and I say, over brush it on a slide. Now they are called pathology lab. So pap smear no, it doesn't come immediately. So because the results are not immediate, your HPV testing is also not immediate. There's a third test. The vinegar and acetic acid, befa awodiana no. It will just give you a color change. Once the color change is there, it means it's positive. With that one, I can treat you immediately. But we'll still wait for the pap smear to come because that one has limitations. So when the pap smear comes, and also it's also negative, you can actually wait. If you do only pap smear, you can wait for 3 years and come back and come and screen. But if you do the HPV testing and then a pap smear, and they are both negative, you can actually wait for 5 years, which is a good time. Because if we say start screening by 25 years, so between 25 years to 60 years, you would screen at least maximum 6-7 times before you hit 60. If all your tests are negative, after 60, 65, you don't need to screen again.
All right.
Well, yeah, I want to ask, what about lifestyle? Is there any other lifestyle activities that people can do to contact this?
Okay, so main thing is sex.
Main thing.
Because it's a sexually transmitted virus. So once you have sex of any type, there are some people who have anal sex, there are some people who have penile-vaginal sex and all that. Once you have sex, because you need contact with the cervix, and the cervix is at the end of the vagina.
So no lifestyle, it's only sex to sex.
So what do you mean by lifestyle?
Yeah,
okay, so if people smoke cigarettes, so there are some people who are cigarette smokers, it increases your risk because once you smoke cigarette, it reduces your immunity. There are some people who have HIV already. That also further reduces your immunity. So if you have the virus, it's not automatic that when you're infected with the virus, you get cervical cancer.
Okay.
So a lot of times people heal and they are fine. But then again, we do not know if you will heal or she will heal. So why don't you all go for screening and then we protect you for the next 5 years? Because from the time you contract the virus to the time you develop cervical cancer, it's within a span of 10 years on average. That is why I mentioned that na yewala. Because within that 10 years, you can come and then we intervene and stop the cervical cancer.
Oh, okay.
Unlike other cancers that you are there and then it comes on its own. You don't know what causes it. You don't know how to prevent it. One notorious one is breast cancer. Otherwise, we won't have a lot of people with breast cancer. But the numbers have reduced for cervical cancer because of the screening. So everybody should be screened.
All right, enti ye maame oba bi oba show no so oye opani abrewa omu nyina ye maame enti ye maame oye doctor oye pathologist e Kolebu Teaching Hospital ene yeni edi nkomo afa kokrama to ema awode ano na waka asem bi ama wo se agumi o se ene Ghana ha se wo yo ba na wahase edi mpamu agro kosi se wo bewu akọwu mpani fie so na wo kohia sa kokrameto awodi ano bia na che se wo are fi se kokrameto awodi ano no yenim ni ede ba eno ni human papilloma virus o ka na HPV no na se wokọ na ye screening na tie hunu ntemu a ebetumi aso ano age nkwa na emu tena se na fe symptoms no ehya se yi ni ti ansa na wakwa ya na akoyebu atibidin na yeni nkomo ebeye den na sese no wo se yanye oba bi obeya sobra kire onkom ye anye ni screening ni bi ya anye ni screening ni bi na se cervical cancer isha se yi ni hu ade a edie na be kire ama oba na ehunu se owo bi.
Okay, so one of the early symptoms is that you bleed. So in between your menses, you have abnormal uterine bleed. You have bleeding from your vagina. Now, apart from that, there are some people who would come with every month.
Okay.
And then there are menopause and so you'd realize that still if you have cervical cancer.
Wow.
The other common symptoms young people present with is that anytime they have sex, they bleed.
Okay.
So
is it painful sex? And I say, yeah.
You can have painful sex,
okay,
or sex that is not painful. After that, you will bleed. In fact, the bleeding happens during the sex, but because you haven't stopped the sex, you don't see it. So we say it is post-sex.
Why do they bleed?
Because the cervix is there. There's a growth on the cervix. The growth is friable, is soft. So when you have sex and the penis has contact with it, you will bleed.
Nti woni obi di mpemu agora sebi mpreduasa ne bema no ewura wase koba no eno ebema saa kokram na eda no na ahyase ama moja aba wo si moja no eba emra wo di mpemu agora na asa wo ti se wa wie bibia ansa na epia mo. So what are we seeing on our screen?
So the one on the left, that's the uterus into our never top ho and a gate no your first cervix no and no down and a vagina no down. On the right, that's the normal cervix. Yeah, this machine no shema. That is what we will see. That's the
So
first picture on the top.
Shine,
Yeah, we are round no. Into the machine no sheho na ye ho sa first one and na your cervix no. Into the brush no be cut sa tokro na your middle no. Na your brush. That is how we get the sample. Into no na your be sa test na your can na. And there are other diseases of the cervix, which is not cervical cancer. It would also show anytime you expose the cervix like that.
Now, again, second one, now you know, Mr. Monsanfa, anonymous kakra, madam. See, I bet me be a number. Second one, now you know, a DNA as in Suacosa, DBS
into cervicitis, infection of the cervix, and yet cancer. Into also the vagina and the discharge, baby, but the discharge, the difference in the discharge between second one any cervical cancer, and say cervical cancer, they know a bone. It's
and can womb.
Okay.
And can womb. It be so because a seven predators and bone. No credit about.
So that is it. Now the next picture, and the cancer no.
And you ever next picture no so.
This is what so if you have sex and then the penis gets contact with this is what bleeds.
So that's why you
I say I know now all round sir.
There's a growth on it. Entiana yehono left like it's all over. It's very irregular. So anytime yet is a machine or two, we will see this, and then we'll take samples as well. But the issue is that don't wait to get here.
Well, if it gets here, it's incurable.
Okay, if it gets here, you can actually cure. So there are options. So the symptoms, what you would see. So in the early stages, those are the things. It's very asymptomatic. You don't see anything. But now, when it starts getting to that growth, you get vaginal bleeding, very offensive.
Explain the pictures now, Sanako. As a back, they ask at Titia Pan Sampao.
Into very offensive.
It's like this is actually very serious. Like for viewers' discretion. Yeah, it's early morning. We understand, but the education has to go on. We have to let you know exactly what it is. That's why we're bringing it to you this morning. So if you're having breakfast, it's okay.
Sorry.
So very offensive vaginal discharge. Late stages. Okay, so in front of our dear baby our Jones or at the back no baby our toilet and so and the cancer bet me spread their queen into and also super homoja or Jones cancer bet me spread their tree and also so many constipation.
Constipation?
Yeah. Now because our down her pelvis no horns so e bi no bet me anya omonai no ebe hu omoya since so be omoya. So depending at the stage of the disease, you get each of the symptoms.
So these are some of the major symptoms with like swollen legs.
Yeah.
Your friend is saying
pelvic pain.
Pelvic pains.
Vaginal discharge.
Vaginal discharge.
Offensive vaginal discharge.
That is
vaginal
the word.
Bleeding.
Offensive.
That means
and kaka krabi. And you are not the Serbia camp. All right, if we can have the photo again. So Dr. Nyakoh can explain.
So
okay, so we're back to this.
So this picture. So the first one is the normal cervix. You realize that it's fine, it's smooth,
fine,
there's
shiny,
nothing there.
Nice.
Then the second one is your stage 1 of cancer.
You
realize that it's still on the cervix alone. So what do? That one, I mentioned that when you put the vinegar on it, the color will change.
Okay.
So when the color changes, you can treat immediately. So you can do, if I know, sometimes when you come to the hospital, we know those who will come back and those who will not come back.
How do you know?
Trade secret.
Those who will come back and those who will not come back.
So the acetic acid, when you use the vinegar, you can treat them immediately. But if I know that you would come back, if I do I'll rather wait for the pap smear, get your results, and then I treat you accordingly.
Okay.
Because if I put in the brush, you realize that the picture above the second picture, the hole in the cervix, that is only diagnosed on pap smear.
Okay.
But if I put vinegar, I would only see the front.
Oh, okay.
So now, most of the cancers occur in the hole, but by the time you get it out, the hole is already infected. So in the very early diseases, when you put in the brush and send to the pathology lab, the pathologist can tell you that, oh, the cancer has started or it hasn't started. Okay. If I know you will come back, I would rather wait for that result and then treat you accordingly. Okay. But if I know you won't come back, which is a common thing in Ghana, a lot of our patients don't come back and all that, you do the acetic acid and treat them if you get positive results.
Why don't they come back?
Financial issues, education not going down well, something that when they come to the hospital, they stay in queue for so long, so they'd rather not come.
Okay.
And some of them come from very far places. I spoke to one of the women I spoke to, said she was somewhere, Eastern region, a Chico baby, and she was supposed to come to Kolebu always, and at a point to die.
Okay, so the good thing also again with cervical cancer is that they've trained a lot. The people who actually do these tests are nurses, and there are nurses all over the country. So you can actually get a test in a lot of facilities. Okay. The HPV testing, fine, you may not get, but the pap smear, they just do the brush in any clinic, any chip zone, any hospital. They take the sample and send to the pathology lab, and then you get your results later.
All right.
So you don't need to wait to come to Kolebu.
I just remember, because I just remember a photo yedi babe to mofidi isui. And what set yedi to so na yedi church the yenu ano mani e maamenum. Na so ni enya kakra. Inti ansa na yedi betu so misrem. Madama, uhwe na untumi nhwa na wapie. Ubetumi ahwe nso atena na hwe frite enim se ebetumi age wo nkwa. All right, until next photo. Okay. This is real.
This is real, but let's go back to the other picture.
Okay, osi yanko okay.
So with this one, you can just go and take the cervix off. So once you go, you take the cervix off, you take the cancer off. Now the other picture, you'd realize the third picture. Okay. You'd realize that the cancer is a white part. It has gone, it has eaten the cervix up more. So in this one, you may have to remove it with the uterus and bring to the pathology lab. No. Okay. That's it.
Yeah, next one.
Now the last one, it has spread. And that is where ubenya moja or junsumu, ubenya constipation, because and then the whole vaginal wall is, you don't want to get there.
This one has
it's very expensive to treat that. You don't want to
do that. Say first stage, yeah. Not to say a bit me wrap a woody munina, or a woody munina was sissy munina.
So much me, yeah, would you
but you still leave cancer behind. You will try. Even if you do your best, you'd realize that, see the picture at the top, it has gone beyond the uterus. And the awarding outline, it has gone beyond, you don't want to get there.
Hi, Mpema Gudi.
Is it true that say Drews are fourth stage now? Yana etumiko hunamna kwa nibi. It can be found in other parts. It can spread to other parts of the body.
Yes,
so it's true. And see, I just remember a photo of that more video. So what is a wish oba wudi anu ni edikano and if a fair shrem sano to true. Next one no mraku kamna shase atwa no see a Drews stage ya ye betumi ayi awudi anano kakra bi na ne treatment kaka na age wonkwa o see a Drews third stage na and what spread this na ye betumi ayi ani wawudi ani nyina ni ama treatment and nso so utie ye betumi age wonkwa na Drew stage 4 na and one hwe ye na be omuye ni ombe betumi ama wato anananom e won siedo nti wo se entwen na new stage uduru stage na one why okay yemfa your last photo nimra na oni hu.
But before we go there, how expensive it is to treat this? Because once you treat nipa for they don't want to probably listen and ask me to an amount to go to the hospital and get the screening going on. But how expensive is that?
Okay, when I say expensive, so financially expensive, emotionally expensive,
okay,
and then your activities of daily living might be limited. You might be bed-bound depending on the stage you come with. What do I mean by financially expensive? When you go to the hospital, you pay consultation fee, right? You see your first doctor. At this stage now, we scan. It probably would have spread. It is a scan, we chest X-ray, we chest CT, chest MRI. They are not cheap, very expensive. We also we pathology lab. Because before they should plan that surgery, they have to get the preliminary diagnosis into biopsy, or the pathology lab,
wow.
Now you see Nyakoh. Surgery is expensive. And yet, Dr. Biana wait me.
When insurance is so cost,
Mr. Insurance being
but yes, insurance be any ho. Enti sorry mommy sorry na kwani yenhwe me ehunu ntemu a na ebetumi age wo nkwa o se e ka bebrebe a wo bo nyina wo mmo.
So you would pay for surgery. After surgery, depending on how surgery turns up, you would go back to radio oncology. When I see chemo for her, radiation for her.
To an amount
today
right now.
When egba merekuku now show egba na yisia. All right, so let's look at the next. Let's go to the next. All right, so I'm sure this is someone's service and then I would
that is the growth on it. So the growth takes different colors, different forms, different directions. It may or may not spread at the time you see it. So this is a real picture, real time picture of a cervical cancer.
Wow. And so that is the cervix we're seeing there,
yes.
the whitish.
The white parts.
And I read in there which boy, no, and
I would,
and I would in any. International says, we are young. Now we shall see any bema than tem. Now, say cancer be bad. Now, yeah. Now, spread this and you are with ya. That's just saying, and no one for you. I'm saying adoption now.
Adoption is possible. Surrogate and so on.
Surrogate and so on. I say surrogate. So this does not affect your fallopian tubes or your ability to lay eggs.
Okay, it doesn't.
Okay, so explain.
Technically, it doesn't. But if you wait for the cancer to spread, it can.
Ooh, I didn't know.
Because the cancer spreads very fast. It spreads very aggressively. So why do you want to wait to get there? So all I'm saying today, right now, here, is that a young, healthy, middle-aged female, you have no symptoms, just walk into the hospital and say you want to check for cervical cancer. And everybody will be ready to help you.
Everybody will be ready to help you. One of the biggest complaints we've had from patients is the treatment they receive from some medical personnel. Atiatia, any ediatem, any senior sabia, brusabia nyado. A big especially government hospital, I be treating one said more. A B see atiatia send no because you have to cry. Please, I know you have something to say about this. I know I put you on the spot, because it's a huge public concern.
Okay. I apologize.
Okay.
For my colleagues who do that.
Okay.
And then it's rather unfortunate. We do not want to do that, but sometimes it happens. I don't think it's intentional, but it happens. So we are very sorry. And we hope not to do it again.
We hope not to do it again. But Mr. Suni, I can't to us when I say doctor ni beti antiam. Na say in the end, obemo edu ahwe mo akukra makwa. I na unhwemu ni say one hospital doctor obusu eni nurse obusu eni. Ukoji ayare hwe minim say say wo yare na say unya krokro bi a ebua mo akoma to yem. UN for definition of good health ni nyina e ka ho. Na nso so ukona so beti antiam na so behwe amode wo daji na brafie. Why? What would you tell some young person, young woman? Meaning, say, about you be sure Max TV say, when you on your bidra. What would you tell? And before you even answer that, cervical cancer, it kills. In fact, Ghana, Afibia 1,699 until it kills. Cervical cancer. Why do they die so much?
Okay, so the whole screening process. So there are people who don't get screened.
Okay.
That is why they even get the cancer to begin with. If you are screened, we'll pick it up early and you won't get to cancer. We pick it up early. What I mean by we pick it up early is that we pick it when it's not yet cancer. So if you are not screening, you would get cervical cancer. And if you get cervical cancer, like I mentioned, in the early stages of the disease, nothing shows. You do not bleed. You do not have pain. You do not have vaginal discharge. So the longer you wait, the more it spreads. And so that is how they present in stage 4, stage 3, stage 4, and then they die. So what do? Please get screening.
And
you don't need to be
they
sick.
come to you when it's at the final stage,
That's
when
the
they are in
commonest
pain
thing.
and bleeding.
That is
the commonest thing.
Yeah.
That is why so many women die. 1,697 or something. Into Amphibia 1,000, Nipa 1,000, and Ma 1,600. And a 97, a bit to me, I will, a bit to me, I will mean so sing Yamin Pengu, a woman Yamin Pengu. And so, Bible, Emma, yet yes, Pefe, Sabibia, or name rent, who bomb pies and Yamin Pengu. Now, Mrasso, say was so sorry now, call, now, yes, share cookram. Is it expensive? No wedding. So, what's screening, no?
The test is not expensive. The procedure is free. And then.
Yes, free, oh.
Procedure. Procedure.
Procedure say yes, shama on free.
And no free.
Abaya resabia.
But what they call aba and over to 120 cedis.
Entity. Say ukoti ensure
HPV testing
free.
Nti uya pass me no pe ubeba every 3 years and no na ne well form.
Okay.
Now so your HPV testing na unya negative results ubeba 5 years if you want a longer duration and no boss so because now we've disseminated it. There are so many people doing it. Then the cost further goes down. But what you say?
And to say uko ako doctor office, ama doctor ne fee wone die. I share a fast sample ne no free.
Health insurance cover.
Mama. It's what
obedi line.
And we obedi line
line on anything. And we dey family planning unit.
You go to
until you are not in the general pool.
Okay.
So we call family planning unit.
So this free procedure, no, it's for every government hospital across the land.
Yes, please.
Every government hospital.
In fact, there are some facilities like PPAG that do that as well.
And also free.
Yeah.
And I say one kokra na afibia ye drew October busumi ni mo. Hospitals bebre private and even government crabo they free oba obetina wa nani aka afa na dimrika obehunu oba tan obewu eja oma ho wuti ase a wutumi koba hwe oma na tisen na wawu wachi beye mobo tinase na hwe oma koni yen fiu na yesi free sample no wo de kwa 120 mami tu yenfo na fe yenko.
Okay, so society I say 3,000 women, 2,000 women. It doesn't look like it would affect you. You are not concerned because you are mentioning numbers and you are not part of the numbers. If it is your mother, if it is your mother, it is no more numbers. If it is your sister, it is no more numbers. So please, everybody should get screened. You shouldn't be sick before you get screened. You shouldn't have vaginal discharge before you go. As you are walking around, send away your plans. Say, "Ubeko market eneno, mpacho faho na ko nya screening." Once you are positive, once you are negative, you 3 years and 3 years you can live your normal life, you can do whatever you want. Now the other thing is that if your HPV is negative and your pap smear is negative, you can get vaccinated.
And it will prevent that.
Vaccination
it will prevent
human papilloma virus no ba o system no entumi nyaw sa na wo kan enti say we are negative your pania yebo. That is some great news.
Very great news. It's just that you still have to continue your 5-year screening.
Okay.
Because once you are vaccinated, I mentioned that the HPV, there are so many types of them.
Okay.
The notorious ones were the ones I mentioned, 16 and 18. The vaccination covers that, and those are the notorious ones. But there are other types that cause other things. That is why you still need screening every 5 years.
Every 5 years. Yeah. Ebusia for your name Venerander wouldn't come here.
I don't know.
Venerander wouldn't the minty bidda. Venerander Nyakoh or a pathologist from KBTH Hospital. And then the wabe treat him a rubber fair son. Unyamiama na Jenny Kessia would yes, she had the Abaya doctor. I'm so proud of her. Not many Ajipas and no Ababe Kayo. Unyaku Ponsrao.